I'm Erin and I'm going to tell you a little bit about lupus and how it affects the body and the lifestyle of the people who have it. It is a very complex disease. It's a chronic inflammatory autoimmune disease in which your body can't distinguish between healthy tissues and non-healthy tissues. There's no known cause or cure of the disease or for the disease. It produces antibodies in your body that attack your body's own tissues, and so that causes inflammation, and it causes your organs to fail. Instead of it choosing like one place in your body or one organ to attack, it can radiate through the entire body, your skin, your heart, your lungs, your brain even. Whenever the disease is active, it is called having a flare-up, and whenever the disease is not active and your body is, for say, healthy, it is called remission. And through this research, I saw how so many people are blinded to hidden diseases and don't know about these types of diseases, even though they are very common in our generation, or just people now. You probably know many people with lupus and you don't even know it. According to the Harvard Health Letter, it can be very difficult to diagnose lupus. There are blood tests that can be performed, but not all patients with lupus will have the positive blood test, and there are other blood tests that may like suggest that one has lupus but not confirm it. But in 1982, criteria was made that if someone has 4 out of the 11 symptoms, they are diagnosed with lupus. And some of these include the abnormal ANA blood test, malar rash, discoid rash, arthritis, ulcers in the mouth or the nose, photosensitivity from the sun, kidney disorder, neurological dysfunction, seizures, and stuff like that. They may have lung diseases, and sometimes people will even have a false positive syphilis test, which can be very difficult to understand. Every case of lupus is so unique, and there's no known reason why there's so much differentiality from people to people, or person to person rather. But there's many factors that can contribute to the presence of lupus and it coming out. A lot of people, through this research, I learned that a lot of people have gone several years having lupus and not knowing it until something triggers it and it just comes out. It can be inherited, stress can trigger it, hormones can trigger it, or it can even be chemically triggered by medicine or vaccines or such things. People with lupus, they can experience hair loss and joint pain and a facial rash and ulcers of the nose and mouth. Some people can have long periods of remission and then have a random flare-up, or some can have like long flare-ups and no sign of remission. The most common cause of death from lupus is kidney failure. There are so many people that that have lupus that their kidneys have shut down and had to go on dialysis, or had to have a kidney transplant even. Like I said, there's no known cure for the disease, but there are many treatments for it. Formulary states that NSAIDs can treat fever, rashes, pain, and inflammation, but it is not recommended for pregnant women or breastfeeding women. And corticosteroids, they work really well with reducing inflammation, but they are not recommended to stop abruptly. They should be tapered down. And anti-malarial agent drugs can treat the rashes and ulcers and the joint pain, but they are very common to cause vision problems. So eye exams are recommended every 6 months. Sometimes if the lupus is very severe and active, immunosuppressive drugs can be used, and that is like chemotherapy or even light forms of chemotherapy and oral substances. Lupus can affect your brain, and a typical term for that can be called lupus fog, and it affects your concentration and memory loss even. It can cause you to be confused, and a lot of people with this have trouble expressing themselves. It can be incredibly frustrating for these people, and it can really diminish your self-confidence. It is very difficult to live with lupus fog and its diminishing traits, but a lot of people cope with it by making sticky notes as reminders or setting alarms for reminders, and they really need to try to forgive others for not understanding their situation, and they just need to always remember that it's not their fault that they have this disease, and that they shouldn't judge themselves because of it, because they have trouble concentrating or remembering or even expressing themselves. Like I said, lupus is a chronic autoimmune disease in which the body produces antibodies and attacks your own organs and tissues. And there's no cure, and there are treatments, but not all the time they help and work, but most of the time they do. World knowledge and technology has came a long way, and through this research I have just learned so much and how awesome science is. In November of 2016, I personally was diagnosed with lupus, and I was told by a doctor that there are so many antibodies in your body that I have no idea what's going on. I honestly don't know how you're sitting here right now, and I've never seen numbers like these, that they've never seen lupus this bad in someone, especially somebody who didn't even know they had it. I was 18 years old, and I'd never had a sign or symptom. It just showed up one day out of nowhere. And now that I have it, and I've realized that so many people don't know about lupus or what it is or how it affects you, and it is a hidden disease really because it's inside your body. You really can't see it unless you have a rash. And so I try to inform as many people as I can about the disease, because it can be really frustrating if people don't know or they don't understand about it. I have a picture of the typical butterfly rash that most people with lupus get on their face. It is across the nose and the cheeks. It looks like a butterfly. It can be scaly, or it can just be red and irritated. But this is the first typical sign that a lot of people with lupus get. Thank you. I hope you learned something about lupus.